Planning is very important in all activities. Planning is very important in your life also. So, many of you may be in the process of making your own home, building your house. So, what will you do for that? As soon as you had the idea of building a new house, will you go and start digging the foundations or laying the foundations for that? Never. So first, if you have the plan or if you feel like building a home, you will start thinking of that. Then you will discuss your plans with your spouse or your family members and your friends. You may go and visit the houses you like the most, and after that, with all your ideas, you will go and meet a good architect. You will have 2 or 3 or 5 or 6 discussions with your architect. You will plan, you will draw a blueprint of your home. Then you will go and see authorities with the needed documents for getting sanction for building the home. Then you will go to the bank for getting home loans. All these are needed. Then only you will go and see the constructor or builder and start building your house. The same thing is needed if you plan your project also. Okay, so in the next 15 to 20 minutes, I will explain what is study plan and what are the things needed for correct planning of your project. Okay, study plan and so the study plan and project management is very much needed to ensure that you have met with your objectives and to ensure that if there are deliverables or end products are delivered at a particular time frame and with the accepted cost. And also ensuring the correct quality standards. Okay. And also to ensure that you have reached the end point which will help you for future implications of the study, future recommendations of the study. That's also important. If you have done a very good study and if you are not going for publication, that is also very bad. Publish or perish, they say. Okay, so and also for future implications. So time management is important, the financial management is important, and also quality of standards and future implications. So all these has to be strictly followed up or monitored for getting a very good end result of the study. Okay, so for that one terminology has to be used is a Gantt chart. That is a chart used for planning of the study at the planning phase, in which you will allocate timing from you start from January 1st for the first you start the study from January 1st and within 15 you allocate it for project writing or your concept paper writing, and after that on end of January you submit it for institutional review board or to the ethics committee, and after that when to start data collection, when to for monitoring, when to collect data and when to start analysis, when to write for publication. Like this you have to chart it, and that is called a Gantt chart. And this ad hoc approach of conducting a study. Ad hoc means very informal, improvisational, without much planning. That type of study will not get much result. It will be non-productive because you don't know what to collect, when to start the study, you don't know what are your objectives, and you don't know what to do with the data. And even if you collect the data, you don't know how to analyze, and even if you analyze the data, you don't know how to interpret, and even if you interpret, you don't know how to bring it or give it for future implications or future recommendations. So always start your study with a very good plan. When you want to do a research or a project, the first thing you do is you will think of what to do, isn't it? So from which area this what to do comes, which area give answer to your what to do. That is identifying the data needs. So if you are interested, I am interested very much in a endoscopic sinus surgery. So if I want to do a research, I'll think on what are the areas, what are the gaps present in the area of endoscopic sinus surgery. So the first one, everything start with an identification of the data needs. Okay, and from these data needs, you have to go for a thorough literature review. The literature review was explained in a previous class. And from the literature review, you have to spell out a research question. Okay. For example, what is the prevalence of chronic sinusitis in patients coming to ENT OPD of Medical College Trivandrum? That may be a research question. So, along with the research question, you have to formulate the study objective. So, the primary objective of that will be to estimate the prevalence of chronic rhinosinusitis in patients coming to ENT OPD of Medical College Trivandrum. So, identifying the data needs, then spelling out the research question and formulating the study objective. Talking on the objectives, usually you have to put the objectives into primary and secondary. So the objectives should be primary objective and secondary objective. You can have one primary objective and one or two secondary objectives. And these primary objectives are usually associated with your research question and also your sample size depend upon the primary objective. That was explained when I talked on sample size calculation. Okay. And also your objective should be SMART. What is that? SMART objectives. That is specific. Specific. It should be very specific. To estimate the prevalence of chronic rhinosinusitis. And you should be very specific on that. How will you calculate the prevalence? How will you identify chronic rhinosinusitis? Operational definitions will come there. And what are the criteria or what are the methods by which you are going to find out chronic rhinosinusitis? All that should be very specific. M is measurable. Okay. If it is a chronic rhinosinusitis, there should be some criteria, major criteria and minor criteria. CT criteria are there. Diagnostic nasal endoscopy criteria are there. So all these should be measurable. And A is achievable. It should be achievable. The target or the objective your aim should be achievable in your particular time period. And relevant to the current scenario and time bound. You can't do your project without time limits. You have to set a time and the objectives should be and the planning should be according to that time period. Okay, so SMART objectives. Then also plan your analysis with the objective, how to achieve the objective and how to analyze so that you can answer the research question. Analysis should be planned and after that you prepare data collection instruments. It may be questionnaires, it can be some investigations or it can be some lab investigations, whatever it is, you have to prepare the data collection instruments. Either you can go for a pilot study or if there is an already validated and pre-tested questionnaires or instruments are there, you can use that also. And all these comes up to 5 is the preparation or planning phase. Only after that you go on with the collection of data. Okay, then after collecting data, analysis data, and then write or draw your conclusions. Then depending on the conclusions, you formulate recommendations and form involving programs. Then also you will identify the data needs. So actually this is a circle, it goes on. Okay, so if you are not publishing, it will end here. There is no use of that. Any project should be published. Then only again the future implications will come on, and also future data needs should be evolved. Okay, so this is the cycle of any project planning. And your study design, how will you design study? The study design depends upon your research question and also your objectives. Again, it was explained in designing the study, and I will give it in a nutshell or in a concise form. So the study design, depending upon your nature of your objective, which depend upon your research question. Okay, so if your nature of your objective is to describe, actually it will be only two types only. One is to describe, in that you find out the prevalence of an acute diarrheal disease in children, or you want to find out acute sinusitis in a particular population, or it can be compared. You compare one disease with another disease. Usually we go for an analytical studies in that. So if it is describing type, it can be either acute in nature or the disease can be in chronic nature. Acute, as I already told, the prevalence of acute diarrheal disease in children. So usually you go with a cohort study or a surveillance study, and you find out the incidence. And if it is a chronic, either you can go with a cross-sectional study, or again you can go with a cohort study, and usually you find out the prevalence. In chronic, it is better to find out prevalence, and in acute, you can easily find out the incidence. Okay, so if your objective is to describe a particular disease or a particular condition, think whether it is an acute one or a chronic one. If it is acute, go with a cohort or surveillance studies, find out incidence, and if it is chronic, go with cross-sectional or again cohort, and you can even go with the retrospective cohort study and find out the prevalence. Then if you are going to compare, you are comparing two things. There is a comparison. Actually it is analytical studies. And again you find out whether it is frequently occurring condition or it is a very rare condition. And if it is a very rare condition, it is always better to go with a case control studies. Okay, rare condition, go with a case control study. And there are always exceptions, but as a general rule, for rare diseases, it is better to go with a case control study. If it is chronic, it is better to go as retrospective. Okay, and you find out odds ratio. Odds ratio for case control study. I was already explaining case control studies and cohort studies are they are explained in detail in previous classes. And if it is frequent disease, either to go with a cohort or with an analytical cross-sectional design. And you find out relative risk, odds ratio or prevalence ratio. Okay, so this is the study design depending upon the objective in a nutshell. After writing out the research question, think in which way you are going to answer your research question. So that is called the indicators. Maybe it is in a ratio or in proportion, or you are going in a rate, or you are going quantitative variables. So decide in which way you want to tell the result or the indicators, and after that decide or list out the information elements you want to find out the indicators. Got it? If the research question is what is the prevalence of acute sinusitis in a particular population, then you want to you decide in which way you are going to tell that result, whether it is in a ratio or a proportion or rate or any quantitative variables. And after that find out the information elements, whether you want what will be your numerator, then what will be your denominator, then also find out whether there is any potential risk factors, or find out whether there is potential confounders. All these you have to find out. That extensive literature review will help you to go through all this. So you should have a thorough planning of all these things, and also the general principles you have to follow. That always give the standardized techniques to collect data, collect this information element, whether it is an observation, whether it's an interview, whether it's a questionnaire, whatever it is. Always go through the standardized and validated or pre-tested things. And if you are using any laboratory techniques, be specific on that. Use the most accurate thing, whether it is a laboratory or other method you are going to collect the information elements. And always use a most accurate, widely accepted, standardized or a gold standard method to collect the information elements. And it should be very specific also. I will explain with an example. Think out your outcome measurement for iron deficiency. There can be so many outcomes. And if the outcome, one of the outcome is chronic iron deficiency, outcome you are going to measure is chronic iron deficiency. What will be the information you want to use? That may be presence of goiter, isn't it? So what will be the data collection method you are going to use? We will do a physical examination for all patients. And this physical examination you have to use the standardized methods according to the standard textbooks. Okay, and if your outcome measurement is current exposure to iodine, then what information you will use? Iodine. Then the information you needed will be an urine excretion of iodine. So you have to use laboratory techniques. Okay, and if you are using access to household salt, then what information you will use? You will have to test the household salt for iodine, isn't it? So what laboratory data collection method you will use? You can use a field spot test. Okay, this is an example to show that according to the outcome and according to the information element, the data collection method has to be decided, and that should be very specific and standardized method, and this should clearly give you the path towards the information element. Okay. And along with this, you have to find out the covariates in iodine deficiency. Covariates in terms of potential risk factors like age, sex, education, the caste, residence, and also the potential confounding factors. In this case, the confounding factors will be age or the gender of the patient or residence of the patient. They are all confounding factor. So in all cases you have to find out whether there is any covariates in your study topic. That is by doing an extensive literature review. After this you go with the analysis plan. It is always better to prepare a dummy table. For example, if it is a cohort study or a case control study, you have to prepare a 2x2 dummy table for calculation whether it is a relative risk or an odds ratio. And also by making a prior analysis plan, you can stick on or you can be sure of your objectives, and by doing that you will not deviate from your objectives or from your research question. You will not make unnecessary comparisons which the objectives or your study is planned for. And also you can look into the information elements you are going to collect, whether it is going to fit into your dummy table, and if not, you can again go back and modify your data collection methods or your information elements according to your analysis plan. And it will also save time for your publication, for your dissemination of your result, and also for policy decisions. And by doing an analysis plan, you can be very sure of your sample size also. And according to your study design, according to your primary objective, you can, and according to your analysis plan, you can decide your sample size. And if you conduct your study with all this prior planning, as you build your dream home, then your study will give a very good results. And all these are reasons for study failures. Reason for failure in your study. One is badly defined research question and objective. Don't do that. Unrealistic time scale. So maybe too short, in which you cannot complete your study, especially if you are having any funding, you will be in a trouble, or if it is too long. Okay, so give very realistic time scale. And inappropriate and incompetent staff. If you find out that, you have to give proper motivation, proper timing, and proper training and adequate monitoring. So even you give motivations, training and your supervision, the staff is not working properly, just replace them and post very highly motivated trained staff. And this is very important from your side. As a principal investigator, you are responsible for your failures and for your good results. So inadequate monitoring will surely make the study a failure. You have to monitor with proper plan. You have to go throughout the study period. You should give adequate monitoring. And if you find out any failures in the mid-course meetings or monitorings, you have to respond and correct it adequately. So throughout the study, monitor that, do a frequent follow-ups of the study plan, and if you find out any problem at any phase, correct it and continue with the study. That is also very important. Okay, so all these should not happen in your study. So to summarize, I will list out the most important thing needed for successful implementation of your project. They are, one is HR management and teamwork and coordination. That is a responsibility of the principal investigator, and also communication. Communication with the co-investigators, communication with the participants, communication with your peer group, your seniors, with the IRC or IEC members. Then time management is very important. Go with the Gantt chart. And also financial management again is very important, especially if you are doing under any funded projects. And also keep on the quality of standards and monitoring for progress and for targets, and also if needed intervene and do corrections. All this will make you a plan, your study a very good internal validity and also external validity, and it will be published. You can publish it in high index journals also. So remember this, and all these points will help you not only in your study and also in your life. Thank you.